Hi, good morning. My name is Bernadette Abrigunda from Maryville University. Today, I'll be conducting my head-to-toe assessment with my friend Mike, who agreed to be my patient today. Before videoing this, I had already Mikey taken his vital signs, his weight, his height, and also he did empty his bladder for his comfort all throughout the test. Also, I did also check his vision through Snellen and the Rosenbaum, and on the Snellen, it shows that he have a 20/20 vision. Today, I'm going to be starting by inspecting his head, his scalp. I could see right now that it's on the middle position, that there's no obvious bumps or any lesions. I'm going to palpate his scalp for any area of tenderness or any bumps, which is none. So his head is in normal cephalic position and there's no area of tenderness or there's no bumps or lesion. While I'm here, I'm going to check also his hair, which is soft and nice and smooth, and there's no area of any baldness. I'm gonna check also his scalp for any presence of any dandruff, which is none. His head and scalp is healthy. After checking his hair and his head, I'm gonna go ahead and check his face right now for any obvious asymmetric or any lesions on his face, which is none. I'm gonna start palpating his sinuses. I'm gonna start here on the frontal sinuses. Do you feel any pain?
No.
Okay. I'm gonna go ahead and palpate the facial sinuses. Do you feel any pain?
No.
Okay. Mikey did not feel any tenderness as I palpate his facial and maxillary sinuses. Right now, I will proceed and check your facial bones to assess for any coarseness or any bumps or any lesions, which is none. As I assess his facial bones, I didn't feel any bumps or any presence of any mass. Right now, I'm gonna go ahead and check your eyes. I will proceed checking your eyes first. On the symmetry, his eyes is equal to each other. There's no lid lag or there's no presence of any eye droop. I'm gonna start checking your eyebrows. It should be full, which is he have a full eyebrows on both. His eyelashes is pointed outward, which is good, and also the eyelids. There's no presence of any bumps or any pimples that I could see, which is normal findings also. Can you please open your eyes? Okay, I can see right now that Mikey's conjunctiva is creamy and whitish, which is normal. And also I'm gonna pull up the eyelid a little bit. It's nice and pink. There's no signs of any anemia. I'm gonna go ahead and get right now my pen light to check his eyes further. Okay, very good. I'm gonna go ahead and check. What I just did right now is I checked his pupillary reaction, which is reactive to direct and consensual light. His pupil is reactive to light and accommodation, and both of them are round, which is normal. Right now, Mikey, I'm gonna go ahead and do some tests to check on your vision. Okay, a while ago I just did the check your eyes through Snellen, but right now I want you to cover your eyes for me. Can you please cover your eyes? The other one, cover it with your hand. Okay, very good. Can you please uncover it? Okay, then do it with the other arm. Okay, uncover it. Uncover it.
Uncover this.
Okay, very good. And that's it.
Okay.
Thank you. What I just did right now is the cover and uncover test. While doing that, I was looking on his eyes for any presence of any nystagmus or jumping of the eyeball, which is none. Also, I noticed that his eyes didn't move as I did the test, which is normal findings also. Right now, I would like to check your visual fields. I would like you to follow my finger with your eyes only. Do not move your head, okay? Mikey's eyes is very smooth when he moves his eyes from side to side and also from up to down. It is well coordinated. I didn't see any nystagmus. His cranial nerve number 3, 4, and 6 is all intact, which is normal findings. Okay, Mikey, after that, I'm going to go ahead and I would like you to cover your eyes for me. Cover the head. Okay, want you to let me know when you see my fingers coming from side to side, okay? Can you see it?
Yeah.
See?
I can see it.
Very good. The other one, can you do it?
I can see it. I can see it.
Okay, very good. Right now, I just checked Mikey's peripheral vision and it's all intact. After checking his eyes, I would like to go ahead right now and check his ears. I'm looking right now, there's no obvious lesions and they are all symmetrical to each other. I'm gonna check, palpate your ears for any bumps or lesion, which is none. His skin on his ears is smooth also. Check for the back. Check for the back, and both of them are smooth. So right now, I'm gonna go ahead and pull your ears and do the tag test to feel if there's any tenderness. Let me know if you feel any pain. Okay, up and backward. Did you feel any pain?
No.
Okay, very good. Now I'm gonna go behind your back, and I would like you to repeat the word that I'm gonna say, okay?
Okay.
Right now, I'm conducting the whisper test to check his hearing.
Apple.
Grapes.
Grapes.
Okay, he repeat the words that I just said, so he's which is good and a normal finding also. Right now, I'm gonna do the rain and the Weber test to check the air and the bone conduction. Okay, Mikey, I'm gonna go ahead and tap this on my palm and put it in the middle of your head and let me know when do you hear the vibration the most? Is it on the right or the left? Okay,
Okay.
Or they are equal.
Okay.
Is it equal? Or
I felt,
more on the right?
I felt more on the left.
Okay, very good. So Mikey said that he felt more on the left. Okay, right now I'm gonna do it. I'm gonna go ahead and do the ring test and put this in his ear. Okay. Let me know when you stop hearing it.
No.
Okay. Let me know when you stop hearing it. Okay, so while I was doing that, I was timing it, and it shows that when I put it on his mastoid bone, it shows that he have a 15 seconds after he stopped hearing it, and when I put it in front of his ear, it stops in 30 seconds. It only shows that the air conduction is longer than bone conduction, which is normal findings also. After checking his ears, I'm gonna go ahead and check his nose. First, I'm going to check for the symmetry. It's in the midline position. I didn't see any obvious deformity, which is normal. And after checking the symmetry, I'm going to go ahead and check that inside on his nose, okay? First, I'm going to go ahead and look for the septum. It's in the midline position. There's no obvious lesions or there's no polyps. I'm checking the turbinates. It's pinkish, and it's also, I'm checking both of them for the mucosa, and both of them are pinkish. I didn't see any lesions or any gray area which could signify any signs of infection, which is good finding as well. Right now, I would like to go ahead, sir, and check the patency of your nose. Can you please occlude one of your nose?
Okay.
Like this, and try to breathe. Okay, very good. And the other one? Okay, very good. Did you feel any hesitancy?
No.
Okay, so both of his nostrils are patent, which is normal findings also. After that, I would like you to close your eyes, and I'm gonna touch your face and let me know when you feel the sensation on your face.
Okay.
I'm gonna apply the on the three areas on his face, the light touch. Okay.
Yeah. Yeah.
Okay, very good. So on the three areas, the sensation are all intact, which is a normal finding also. Right now, I'm gonna go ahead and proceed to check your lips. I didn't see any lesions or any cracks or fissures on his lips or in the corner, which is normal. It's moist and pink. Right now, can you please smile for me?
Yes.
Okay, I could see that his teeth is all color white. I didn't see any cavitations from the outside or any missing teeth. Can you please open your mouth? Okay, very good. I'm gonna go ahead and shine the light so I could see it further. Okay, very good. I didn't see any cavities on his teeth also. Mikey, can you please stick out your tongue for me? Okay, very good. It's in the midline position. Can you please move it side to side? Okay, very good. He could move his tongue from side to side and it's in middle position. Can you lift up your tongue for me? Okay, further so I could see it. Okay, very good. Open your mouth. Okay, I didn't see any lesion. Right now I'm checking on his tonsil. And both of them are pinkish. There's no redness. Open your mouth more. Okay, and I'm checking also the uvula. It's in the midline position. The soft and the hard palate, which is pinkish also. I didn't see any lesion. I'm checking right now on his gums on both sides, and I didn't see any lesion also, which is good. So Mike's tongue is in midline position. There's no lesions on the anterior-posterior palate and also on the lower palate, and none on the gums, which is a normal finding. Right now, I would like to check the cranial nerve on his face. Mikey, can you please close your eyes tight for me? Okay, wrinkle your forehead. Okay, very good. And then pop out your cheeks. Okay, very good. Stick out your tongue. Okay, cranial nerve number 7 is intact. And also when I just checked the hearing, he have a cranial nerve number 8 intact, which is a normal finding also. Right now, I'm gonna go ahead and proceed on his neck assessment. First, I'm gonna inspect it for the position. It's in the midline position. I didn't see any leaning towards to one side, which is perfect. I would like to check the back also for the cervical position, which is concave, which is perfect too. I didn't feel any masses right now, or I didn't see any bulging on his neck. Right now, I'm checking on the sides for any presence of jugular vein distension, which I didn't see anything. His neck is all flat. Can you please lift out your chin for me? Okay, I'm checking right now the thyroid, and I didn't see any enlargement of the thyroid. I'm gonna palpate right now the trachea. It's in the middle position, which is normal finding as well. I'm gonna go ahead and check this thyroid for any nodularity or any enlargement. Can you please swallow for me? Okay, very good. Can you turn your head towards me? Swallow. Okay, very good. On the other side. Swallow. Okay, very good. I just checked right now his tonsil. I'm sorry. I just checked right now his thyroid for any nodularity, which is nothing. So Mikey's neck, there's no there's absence of jugular vein distension, and also his trachea is in midline, and there's no enlargement of thyroid. So what I would like to do right now is to check the carotid for any bruit. I'm gonna use the bell of my stethoscope to check both of his carotid. I didn't hear any bruit on both of his carotid and also on the thyroid, which is a normal findings. Right now, I would like to palpate the carotid arteries. While checking this, it is very important that you do it on separate time to avoid occluding the circulation. Okay. Just normal findings also. Right now, I would like to go ahead and check your back. Mikey, do you mind taking off your shirt?
No.
I'm gonna go behind Mikey so I could check it. Mikey, do you mind turning on your side?
No problem.
Okay.
Is that fine or
A little bit more.
like that?
Okay. So right now I'm checking on Mike's back. Okay. Let's go this way. So right now I'm checking on Mike's back for any signs of any irritation or any redness on his skin, which is I didn't see. And also I can see right now that the thoracic cavity is in midline position. I didn't see any kyphosis or any lordosis, which is a normal finding too. Right now, I didn't see also while he's breathing, I didn't see any signs of respiratory distress. There's no use of accessory muscle while he's breathing. And the skin also is evenly distributed the color, and it's appropriate for his ethnicity, which is normal. what I would like to do right now while I'm here on his back is I would like to check the expansion of his lungs. But prior to that, I'm gonna go ahead and palpate